Hi everybody, welcome back to my YouTube channel. Today we will be discussing on heart murmurs. Now there are two things you should know about heart murmurs. The first is you should know the pattern. The pattern is very important. And once you know the pattern, you correlate with your patients, you correlate on YouTube, you correlate on I've recently seen a video where correlation is done on a shoebox. People first tap with their fingers, the lub and dub, and then after we just learn the basic love dub feel, they take a pen or pencil and they scrape on it and make the murmurs. Now it's not about making the murmurs that's interesting. It's how accurate the murmurs are, and it is really slowly done first. So you will know where to listen what. So I recommend everyone to listen to those videos as well after getting an idea on this basic graphs or correlations what I make to the pattern of cardiac murmurs, because cardiac murmurs, it's in the textbook in the form of graphs, right? Going up, going down, a flat graph, and some, what is it? In case of aortic regurgitation, a decrescendo graph. So I'm going to make it more interesting. So let's begin. So first there are two sounds, right? The two sounds of interest. They are going to be a S1, they're going to be a S2. Then there are going to be those dangerous sounds, S4 and S3. Okay. So, and this is the basics. So let's start with a simple concept that you should keep in mind: aortic and pulmonary, mitral, and tricuspid. Their murmurs are similar. Okay, the patterns are similar. It's only the place where you keep it. For example, aortic murmurs are heard better in aortic area. Pulmonic murmurs are heard better in pulmonic area. So that is the concept. And for any valves on the right side of your heart, that is tricuspid and pulmonary. So their murmurs will increase on inspiration. The left-sided valves murmurs will increase on expiration. So using this concept on your patient, you can further go ahead and identify. So let's begin. So first, I like to start with aortic stenosis. Aortic stenosis. Now, aortic stenosis and pulmonic stenosis, they have the same graph: S1, S2, S1. Okay. Now, I like to introduce to my new friend who is Kaju. Do you know Kaju? Kaju is an Indian sweet. It is extensively made because if any relatives come to my home, they're definitely gonna get this sweet or a variant of it. Especially Diwali's, the sweet is homemade. Otherwise, if you're getting it's mostly from the shops. So the homemade ones are more tastier. Now, the importance of the sweet is the shape, because Kaju shape is all we need to know. All the Kaju lovers will know the importance of the shape. So this shape is going to help you solve all your problems when it comes to knowing the murmurs. So aortic stenosis. What is aortic stenosis? It increases and it decreases in the systole. This is the systole. S1 to S2 systole. S2 to S1 is diastole. So anything that increases and then decreases in intensity, we call it as crescendo decrescendo. So decrescendo decrescendo at the aortic area is aortic stenosis. Crescendo decrescendo at the pulmonic area is pulmonic stenosis. So crescendo, decrescendo, systolic murmur. Now, it's interesting to note that there you go, you made it into a peda or kaju. Some people call it peda as well. So our kaju is ready. So that murmur is done. Now, if you want to go with aortic regurgitation or pulmonic regurgitation, same story. Okay. So always remember aortic regurgitation is a decrescendo. Decrescendo. So how are you gonna do that? Yes, it is a decrescendo, early diastolic murmur, because it's in the diastole phase, S2 to S1. Okay, so early decrescendo murmur. And this is going to be a half kaju, right? Someone broke the full kaju to half. So there you go. We finished them. Now let's go to the next one. And that's going to be mitral regurgitation. Now it's interesting to note that when you come to mitral regurgitation, it's a rectangle. Let me illustrate this to you. S1, S2, S1. Mitral regurgitation or tricuspid, based on where you auscultate and hear the sound. So it is a holosystolic murmur that radiates to the axilla. Okay, so holosystolic murmur that radiates to the axilla because it's in the systole component. So holosystolic. Okay, well now there's one more murmur that fits, that is ventricular septal defect. Ventricular septal defect also has a holosystolic murmur, and it will be heard best at the along the left sternal border. Okay, so along the left sternal border. Place your hands on the over your left sternal border. Yes, that is where you're going to hear it. Now, let's go to hypertrophic cardiomyopathy. Now, hypertrophic cardiomyopathy is like our aortic stenosis and pulmonic stenosis. It looks like that, but it's little different. Okay, so let's talk about hypertrophic cardiomyopathy. S1, S2, S1. So it is again a crescendo decrescendo murmur heard at the mid left sternal border. So crescendo decrescendo. But there is a space towards S2. And please, for me to add one more point is that when you're speaking about aortic stenosis, remember the S2 will be split. It will be split into two. It will be split into a pulmonic and aortic component if it is aortic stenosis, because aortic stenosis will have a delay in aorta. If it is pulmonic stenosis, it's the opposite. The P2 will be delayed. So I have forgot to mention it. So you are not going to hear it at all. Okay, you're not going to hear the split exactly. Do you know why? It's because, see, S1 started here and it's all the way to S2. So this sound is a part of your this rhomboid murmur. So you will never know it. You will just know there's a small gap of a few milliseconds, and then you will hear S2. So you may think this is the S2 sound. No, but the S2 is already split. That is the sound of the valve whichever is closing. If it's aortic stenosis, it is A2. If it is pulmonic stenosis, the P2 will replace, because P2 will be delayed. So P2 will come after A2. Okay, so keeping that discussion apart, HOCM, similar. You'll hear a similar sound. It just ends earlier and then you'll hear an S2. Okay, now let's go with the famous, most important, most commonly seen murmur, that is the mitral stenosis in the developing nations. Now, mitral stenosis is having its own tricks. Mitral stenosis is going to have something called as an opening snap, which you'll hear in the diastole phase. Okay, so in the diastole, you're going to hear an opening snap. Once you hear the opening snap, it is followed by a decrease, and that is called as a mid diastole rumble, followed by a pre-systolic accentuation. So usually it won't be this long. Let's keep it like this. So pre-systolic accentuation. Okay, let's keep it small. Okay, so it'll be easy for me to draw. Yeah, so it will be have a pre-systolic accentuation. So this is S1, S2, S1. So a mid-diastolic rumble. First you'll see an opening snap, then you'll see a mid-diastolic rumble. Then this is S1, right? And from S1 again the systole starts. So this is called a pre-systolic accentuation, and that's how you'll hear mitral stenosis. Now coming to a unique variant called as a mitral valve prolapse. Now what should you know about mitral valve prolapse? Tell me. It's easy. There's nothing to much to worry about mitral valve prolapse, right? Because mitral valve prolapse is just like mitral regurgitation, except there is a click followed by a holosystole. Okay, so that is how you hear a mitral valve prolapse. So it is called, this click is called as a mid systolic click, followed by a late systolic murmur. Okay, so mid systolic click followed by a late systolic murmur you see in mitral valve prolapse. Then let's go to the easiest one. There's only two more left. Patent ductus arteriosus. What about patent ductus arteriosus? It's a continuous missionary murmur. So you will hear just like a continuous machine or like a train. Some people call it train as well. So you'll hear like this. It then keeps, oh sorry, it doesn't. It goes a little bit, intensity increases a little bit towards S2. Again, this is S1. So again, it goes straight. And whenever S2 comes, it goes again a little bit higher in intensity. Okay. Then let's talk about atrial septal defect. Now, atrial septal defect is very unique because atrial septal defect will have a mid-systolic murmur. Now, mid-systolic murmur, so it's going to be just here. That's it, whatever. So it's going to only be here, and you're going to see a split, a fixed split, because atrial septal defect, because there's a defect in the septa, the pressure is high over here, right? And it's going to go over here, and going to go here, and hence because of this, there is a delay in the pulmonary valve in closing. So there will be a delay P2 and this is going to be A2. And this split is a fixed split. So this is a fixed split. So you're going to see a fixed split and then you're seeing a mid-systolic murmur. So just remember this. Now ASD has, not only ASD, all these murmurs, they'll have variations and there's a lot to learn in murmurs. Okay, certain murmurs will be heard differently. For example, patent ductus arteriosus, where to palpate. The best place to palpate is interscapular. So between your scapulae, right? This is a scapula, this is one scapula, this is another scapula. So between scapulae, you need to auscultate. So that is how patent ductus arteriosus is. But this is just a simple murmur illustration which I'm dedicating to the suite. The suite is called as Kaju. It has so many variants of names, but this suite is going to solve the basic necessity of knowing the shapes. So thank you everyone. Please like, share, subscribe, send send this to your friends, your family, to any echocardiographer, to somebody who's interested in being a cardiologist, anyone in medicine field. Please share this video. It's going to help them a lot. Thank you so much and have a great day ahead.